Great. Hello, everyone. My name is Daryl Heller. I'm the director of the IU South Bend Civil Rights Heritage Center. And I'd like to welcome you to a continuation of a conversation we began last fall, addressing the issue of racism as a public health crisis. I mean, it was in part a response to a resolution that the St. Joseph County Board of Public Health put out last July. So we have an esteemed and very knowledgeable panel here that we're going to be talking particularly about mental health as a healthcare crisis in particularly African-American communities and communities of color. But before we begin, I'd like to introduce Dr. Tom Fisher from the Dwyer College of Health Sciences, School of Health Sciences. I think I mess that up every time. But Dr. Fisher, if you would like to do a welcome, that would be wonderful.
Thank you, Dr. Heller. Yes, I am the Dean of the Dwyer College of Health Sciences at IU South Bend, and it is my pleasure and honor to welcome you to another important conversation. The Inclusive Action Advisory Council of our college planned tonight's discussion. The council was formed out of the college's strategic plan 3 years ago, where we first had this as an ad hoc committee to begin looking at making our college more diverse with its faculty, students, and staff. And then it became a permanent council with the vote of the faculty council last year. Much has happened during those 3 years with relationship to matters such as race, racism, health disparities, and public health. Our college is committed to be a community leader in the work toward equitable health outcomes. We practice our commitment to anti-racism by promoting community dialogue. When the St. Joseph County Board of Health declared racism as a public health crisis about a year ago, the council felt a call to action. And then on October 27th, the council sponsored part 1 of this dialogue about racism as a health crisis. If you could not attend, please find the recordings on the Civil Rights Heritage Center website. The College of Health Sciences wants to keep this conversation moving. Tonight's event focuses on the lens of public safety and mental health, as Dr. Heller shared. This is a timely subject following the conviction of a police officer for a murder of George Floyd, which spiked in mental illness and suicide during the pandemic, and ongoing health disparities in the incidence and death from COVID-19. Tonight, we grapple with the conversation between historical trauma and ongoing mental health in an environment of increased scrutiny and accountability for police departments, and how we can collectively advocate for this decriminalization of mental health issues and reallocate financial resources to address the overwhelming need for mental health services. We will hear the experience and wisdom of healthcare practitioner community members who have important knowledge and ideas to lead us in this work toward health equity. We expect the conversation to be at times uncomfortable and challenging. We invite all of us to remain open-minded and to lean into this discussion with curiosity and a fierce belief in the dignity of our neighbors. Please be brave, not just safe. On behalf of the Vera Z. Dwyer College of Health Sciences, I thank the Civil Rights Heritage Center for hosting this evening's event and being an important partner in our work of the council. Thank you for the panelists for sharing their wisdom and expertise with our community. And with that, I will turn it back over to Dr. Heller.
Thank you, Dr. Fisher. And thank you for those words to us. As Dr. Fisher said, we're continuing the conversation, and this is a second event that we're having, but the conversation itself is ongoing because the issue of mental health and public safety in our communities is such a dire issue, particularly in the national context. So we want to look at the national context, but we really want to focus on what's happening here in South Bend in our local community. I don't have much more to add in terms of context than Dr. Fisher said. So what I'm going to do is just give our panelists an opportunity to speak And what I'm going to ask each of you to do, and we'll just go down the line, is to introduce yourself, kind of what your context is, and then where do you enter into this conversation, and what do you think the real issues are around mental health, around public safety, and how the two are related. So I'm going to begin on my right with Susana Lagunas, who is with the Indiana Health Center Inc.
Mm-hmm. Hi, everybody. So I'm Susana Lagunas. So I'm Susana Lagunas, a nurse practitioner. Work for Indiana Health Centers. We have 3 clinics here locally, and we serve, for the most part, the downtown area, the west side area, and the northwest side areas. And if you're from this community, you know this is the area of greater need for medical services, and there is a lot of need for mental health services. So I get to see firsthand patients from this area, members from this community, and try to kind of guide them through a lot of their medical needs.
And Dr. Chisholm Buggs, who's with Oakdale.
Okay, good evening, everyone. I want to thank you for this invitation. I'm very happy to be a part of this esteemed panel. My name is Dr. Chisholm Buggs, and I work at Oaklawn. That's my clinical practice. I also have a private practice in forensics. I'm a board certified psychiatrist. I'm a physician, and I'm from the area. I'm a South Bend native. I am married to a wonderful African-American husband, David Buggs, and born to proud African-American parents, James Chisholm and Elnora Chisholm. And they really instilled a lot of value of family, value of community. Growing up in this area, moving away for training, for medical school, residency, and fellowship, and then coming back to the area and practicing here in town since 2009. I've seen a lot of changes, and in my practice, certainly there have been many, many changes as well. And I think the most significant change is the interjection of structural racism into an open dialogue and conversation. I think that the time, the passing, the death of George Floyd, locally Eric Logan, and others around the country have really changed the landscape of the open dialogue that we're able to have. It's not a new dialogue, but it's certainly a necessary one that I think is long overdue. And I think it's really, really important that physicians, especially African-American physicians, join in the dialogue so we can work with other community leaders, other educators, other just concerned citizens to help address this issue and improve the mental health of the local community. And that's why I'm here. I should also say, while I work for Oaklawn, my views and opinions are my own this evening. That's my disclaimer.
Point well taken.
Yes, they do a lot of good work. I don't want to diminish that at all. And I wouldn't do that anything that I would say, but I just want to make that plain.
Great. Great, thank you. And to my left is Ms. Deborah Stanley, who is the director of Imani Unidad.
Yes, good evening. And again, thank you for having me. I feel like the Civil Rights Heritage Center is my second home. But anyway, as the founder of Imani Unidad, we've been around for 18 years and interested in several health issues in this community: HIV, substance misuse, the criminal justice system, which are all health issues for us, but taking it from a mental health approach, and not just the mental health of the individuals that we serve, but the mental health of the entire community. Because if we think about this whole notion of racism, those who inflict intentional harm on others, oh my God, the consideration for what their mental health must be. And so working with folks and becoming advocates for systemic change, because it is these unhealthy institutions and systems that do harm and create unhealthy individuals. And so it's that approach that we take, and understanding that the things we think and feel and believe about ourselves determine our physical health as well. And so it's trying to put all of those things together and become educators, advocates, and preventionists in this community. Thank you.
Great, thank you, Deborah. And my far left is Mr. Savino Rivera, who is with the South Bend Empowerment Zone.
Great. Thank you so much. It's an honor to be here tonight. Just a man amongst giants here on this panel. So definitely with the South Bend Empowerment Zone, South Bend native here, just so honored to be able to finally express something that has been downtrodden here in South Bend for the longest time. And we've been brave enough to actually speak up about it now, and just honored to be on this panel. Have a track record in education in South Bend schools, higher ed, as well as in community health with Beacon Community Impact. And I've served this past year with the South Bend Empowerment Zone, which is a non-for-profit over the 5 schools on the west side of South Bend: Coquillard, Harrison, Wilson, Warren, and Navarre, where we serve in excellence, as well as anti-racism and educational equity. This is just so, it just hits so close to our mission, because for so many years, for generations, I'll dare say, that the west side of South Bend, which is predominantly African-American and Hispanic, has been forgotten about. And just this demonization of mental health as being those bad people over there. They've gotten a bad rep for years. And I'm happy to say that we are actually getting away from that old way of doing things, and we're seeing people for who they are, and we are rebuilding them, and we're bringing them back better than ever. And it's just an honor once again to be able to say that we're doing this great work and to be able to share that with you today. Thank you.
Great, thank you, Savino. And joining us remotely is Dr. Laria, who's, I won't say where she's joining us from because she said it made us all jealous, but she brings a vast expertise on this issue. So I would like you to introduce yourself, Dr. Laria.
Hi, welcome. Thank you. Thank you so much for having me, Dr. Heller, and this, as has been said before, the highly esteemed panelists. I wear multiple hats. I am an associate professor in the Counseling and Human Services Department at IU South Bend. I'm also the department chair, and I am also the founding director of GC Scored, which is a nonprofit organization. GC Scored stands for the Global Center for Systemic Change, Outcomes Research, Evaluation, and Development. And this is, as it says, it's a global organization. What we do in this organization is we have developed a framework that has reconceptualized and reimagined mental health, looking at mental health from a social emotional wellness perspective, using social emotional skills. The reason for that is as we all know, one of the main issues that we struggle with that's a barrier, right? That's a barrier and that creates stigma, is the language surrounding and attached to mental health. Just the words mental illness, mental health, mental anything has major negative impact on people of color within the South Bend area, across the globe, across the US. And so our focus is to destigmatize, demystify, rename, reconceptualize how we engage with mental health. And as everyone has said, this is a topic that its time has come to talk about with all honesty and openness, so that change could occur. And because we have so many different individuals from different spaces on this panel, it's just representative of how this topic has so many different ways to look at it. And it's important for all of us to be at the table. And I applaud the School of the Vera Dwyer College of Health Sciences. Even though they are right below our department, the School of Ed, I could never pronounce it properly, but and Dr. Heller for doing this. You know, it's really visionary, and it's necessary that you guys have done this work and have started a conversation, as I said earlier, that needs to be had. And so I am honored to be here and look forward to our discussion.
Great. Well, thank you, Dr. Laria. And actually, I want to start off the conversation with something you said. Because I want to hear from each one of you, just kind of what your initial thoughts and or responses were when the Board of Public Health declared racism as a public health crisis. And what you said, Dr. Larry, I think is really important is like within that, when we address the issue of mental health, and particularly the stigma that prevails, particularly in communities of color, around mental illness or when we talk about mental health. So how do you think about folding racism as a public health crisis with the stigma that's affiliated, that's associated with mental illness or the need to have mental health services in our communities? And I just want to open up to anyone who wants to start.
Well, I'll start off. You know, when I first heard about the declaration, I was shocked. I was so surprised that this happened in South Bend, Indiana. Not because it was something that wasn't happening in other areas, but having grown up here, moved away, I said, and done training elsewhere, I haven't always viewed our community as being the most progressive when it comes to issues of mental health, wellness, and really just bringing different communities to the table. And so when I heard this, I wanted to go and find it. I was looking, I was reading, I was searching because I was really shocked. And once I got a chance to take a look at it and begin to just think about the implications for this, I feel like I was able to exhale. And after that, it was for the first time in my life, in my professional life, I had colleagues ask me, well, how are you doing? How did you feel about this thing that happened? Or have I ever done or said anything that was offensive? Now, on one hand, you don't want to be that person, that Black woman who is now representative for the entire race, answering for everyone. But at the same time, it was something refreshing because there are instances where I was privy to certain situations or made an observation that I thought was based on something that I thought was unfair or racist, and having to speak on that, being the only African-American psychiatrist, by the way, were about 3% of the entire profession. So by and large, unless you live in a large metropolitan area, you will be the only one. And so feeling obligated in some situations and circles to bring things up and bring things to the forefront, as necessary as I found it, it was also uncomfortable because it challenges some notions, some beliefs of people sitting in the room around you, next door to you, people who may not necessarily share the same viewpoints. But this declaration, I think, gave a new platform for that discussion. It put it in a context that I think made discussions of race and mental health accessible to people maybe who weren't on the same page or maybe weren't able to sit at the same table figuratively beforehand. And so it was just a really wonderful thing that the public health department did. And I think it's really created new opportunities for this dialogue and this discussion to continue.
Can I say something now?
Yes, please.
Oh, okay. I agree with Dr. Bugs, and I will add that it has given, and this is not a real word, but it has given oomphness to the reality, the lived experiences of hundreds of thousands of people who go through on a day-to-day basis the microaggressions, the micro invalidations, the micro assaults, and the overt racism that is experienced in every system of our societies and our community. And we're talking here specifically about South Bend, that our area here. And so when you have something that says, oh, this is what it is, it gives validation. It makes you feel seen. It makes you feel heard. It makes you feel like you matter, because there's a name now attached to what it is, and it's now coming out, or has now come out of the shadows. And so I think when I heard that, I felt a sigh of, I was able to exhale.
You know, I think that that's really important what both you and Dr. Bugs had to say, like legitimizing
Yes.
that and giving it, you know, some validation. And I know, Deborah, that Imani Unida deals with stigma around a range of issues. What do you think? How do you approach this?
So when I first heard it, of course, it really, any of these kinds of proclamations, my first instinct was, okay, the whole Jim Brown to Richard Pryor, what you gonna do? That's all I wanted to know. You made this proclamation, now what you gonna do? So I called a colleague at the health department. Okay, who created this? Who was on the committees? I wanted to know all of those things. So she told me that it was a group of white people. So, okay, I'm okay with that, because racism is, quote unquote, the white man's burden. They created it as a tool of divisiveness so that white people couldn't see, you know, Bacon's Rebellion when indentured servants looked around and saw that, oh gosh, we're no better off than these black slaves over here. And they united and they rebelled. And so they were given racism as something to pacify them and accept that their lot was no different from, but we will give you this race, you know, so go away and be happy. And so I'm just looking, I went through the whole proclamation, I'm reading it, I'm looking at it line by line, and I'm feeling comfortable. And then there's some things I'm questioning. So they're talking about hiring community health workers, people with lived experience, those kinds of things. And then I'm questioning, well, are they gonna have the same value as that MPH, you know, that person with the Masters of Public Health? But that person with a Masters of Public Health who cannot actually serve because they are educated and indoctrinated, but have no real connection to community. So that those are some of my continuing questions. The value that is going to be placed, who's going to make these decisions, what is it going to be based on? Are we going to continue to look for people who are going to make sure that white people stay comfortable and in their power positions, or are we really going to hire people who are going to get in there, tell some truth, affect some change, et cetera, et cetera? So those are the things that, to me, it's a work in progress. It's a wonderful beginning, but we cannot stop here. We got to keep working. We got to hold their feet to the fire. I was looking throughout the whole document for action words, not we will try, but this is what we're going to do. I'm looking for a timeline, you know, and so, yeah, because a lot of times these documents leave room for us not to do anything, you know, so again, it's a good start, wonderful start, and we just gonna hold their feet to the fire. And it doesn't matter if the administration changes. We just got to keep it going, no matter who's in there.
No, thank you.
So I agree with Ms. Deborah here as far as looking for the action part of this resolution. Because yes, it looks great on paper so far, I see that as well. But the important thing is that how do you implement it? How do you really take that paper from just being a paper with nice words into the action that needs to happen in order for systems to change? And I think overall, it's a great start of the conversation, a great way to bring people together and discuss from other areas ways to tackle this issue. In my opinion, you know, from the past president year, we had racism very prevailing. And I think overall, it just kind of resurfaced full blown in the last couple of years. It's just kind of embarrassing that it is 2021 and we're still dealing with racism as one of the biggest issues in the whole country.
Yeah, and I want to bring Savino in here. Savino, you mentioned in your like the Latino community. How does this play out? And not that I'm asking you to speak on behalf of the entire Latinx community, but can you about the issue of stigma and your sense of how folks are in that community are thinking about the issue of mental health, mental illness, how the pandemic has had particular effects, you know?
Yeah, definitely. I think that I've always said that the silver lining of this pandemic is that we're actually seeing, or we've actually put a magnifying glass on the topic of mental health, especially in any type of the African-American community and the Hispanic community. It's something that just didn't exist. It was actually kind of put into kind of like a folklore tale that you actually had to go visit someone to get blessed. And it was in tradition to where you had to get this prayed off of you. You went to the bishop to get this taken off of you, or you just had a bad omen, or someone cursed you. Those things still exist to this day, right? But finally, I think a resolution like this allows us to have real conversations about what direction we're going. And I really agree that this is a step in the right direction. Not exactly what we all want at this point in time. You know, this is not all that we're going to be satisfied with, but it's a step in the right direction to have these conversations and to bring about change. I definitely feel that they're aligned with all the good fight that we're all trying to fight right now against racism. And we're actually able to kind of bring it up. We're actually brave enough to actually talk about it now. And it's something that, unfortunately, a lot of Hispanic families, due to language barriers, educational barriers, and just even cultural barriers, haven't been brought up to speed yet. But with time, I know that this is our job. This is the good work that we are still fighting and that we're doing now to bring everybody to the table. Because gone are the days that folks are deciding things for us, that we actually have a seat at this table now, and that we can make a decision for ourselves.
Mm-hmm. And thank you. I want to kind of bring out a related issue, which is stigma has often been played out as in almost criminalizing people for having mental health issues. I mean, we know when we couple mental health and public safety, that many calls to the police and situations that escalate out of control are really mental health issues, not public safety issues, or provoked by mental health issues that then devolve into public safety issues. How do we address the criminalization of mental health issues or mental illness? And how can this resolution and the demand for action, as Deborah said, be a catalyst for making mental health issues non-criminal actions or a non-criminal behavior? I'm going to start with you, Dr. Chisholm-Buggs.
Sure. And I think I have a unique perspective, and not only because I'm an adult psychiatrist, but also my work as a forensic psychiatrist. I do work for the courts in St. Joseph County and Elkhart County. So for people who might have mental illness, who find themselves in the penal system, and there's a question of competence, or there's a question of sanity, or if you see someone and they said so-and-so underwent a mental health evaluation, that's the kind of work that I do. And it is from that perspective that I see people with mental illness sitting in the jail for a longer period of time than would otherwise, for lack of a word, be necessary were it not for their mental illness. And perhaps their crimes are low-level crimes, misdemeanors, which speaks directly to this issue of criminalization of mental illness. And so I see that, and what has been done about it in Indiana, not much. I've had different conversations on what might be able to happen to ensure that people, just by nature of their mental illness, and because in the American legal system, we want to ensure that people are able to be competent, for example, when they stand trial. How can we expedite the process to restore competence? How can we get people to the most appropriate place to give them the most appropriate treatment in the least restrictive setting possible? Sometimes that means, yes, going to the state hospital for competent restoration in the forensics setting. But other times, when there is not a major question, but there is the major and obvious issue of mental illness, how do we get to the point where people are diverted to the appropriate place? And I think that's the question of decriminalization of mental illness. Because yes, mental illness has different manifestations, different presentations. And as a psychiatrist, I study human health and behavior. And so I think it has to get we have to get out of the fallacy of believing that everyone who has mental illness is dangerous. There has to be discussion and recognition that de-escalation tactics are important, because when we're going through a crisis situation, the last thing that you want to do is have someone in a crisis situation met with unnecessary force and confrontation. We all know what happens with that. Things get worse. And when things get worse, people by and large end up going to jail. And so as we think about how we have these systems that are in place, and I do think that law enforcement is necessary, but how do we police? How do the police, for lack of a better word, police? What is this system or structure that is in place that perhaps doesn't allow enough humanity to be observed when someone is encountered on the street? We need to take a look at that. And we also need, as a society, as a Black people, to also look at how we look at mental illness. And I think that's where stigma comes in, because it's not just about having those discussions over there with those other people. It's also about having them with ourselves. Because when we don't even talk about mental illness, you run into a host of issues. You don't recognize it when you see it, or you simply dismiss it as a spiritual problem. And there are distinctions between spiritual issues and mental health issues, but all of them can't be prayed away. And there's no reason that mental health professionals, psychiatrists, and clergy, my husband is a pastor, can't work together to help provide and sustain a culturally competent narrative that improves health outcomes. So that's what I wanted to say on that.
If I may.
Yes, please.
I want to make sure we bring in Doc over there as well soon. I love that what you just made mention to, right? That collaboration, that community approach to this. I think it all starts at the grade school level, if you think about it, because for time and time again, there's just a blatant distinction that folks that look a certain way may suffer from mental health issues, but they're still demonized as those bad kids or those kids over there. But those who are over here, who are typically of white complexion or lighter skin complexion, that's okay. And it wasn't until we looked into a root cause analysis that throughout the corporation that we're noticing that a lot of, and this is nothing new to anybody, we've known that it's been there, but we're actually talking about it now, that why is it that someone who has more of an African-American sounding name or African-American male receive more of a days of suspension or a harsher sentence compared to someone who is not? These are real questions that we're beginning to ask, and that we're finally saying, I keep saying that we're brave enough to start asking now, but it was just this is the way we all do things. And it wasn't until folks actually started talking about mental health, and that I think the pandemic kind of showed that everybody's suffering from something, that we were able to start asking these questions. But it starts there. And then, we all know, I know I'm preaching to the choir, that, it's individuals with a low reading level or that are illiterate or don't get to a certain grade. we're building a pipeline. We're definitely building a pipeline into suffering, or I mean, I'm not even going to say what other things that could take place, but it starts there. And once we start actually making inroads to make it a difference in our schools, elementary, middle school, and eventually high school, we're going to be spinning our wheels with adults all day. We have to make a stand, and we have to start making a difference now. And it's a complete community effort. It's not just your teachers. It's folks, everybody that's on this board, folks who are viewing now. We need you as volunteers. We need you to be mentors. We need you to talk about and be an advocate for individuals who are in need. Because if you're just saying, hey, those, them, him, that, or the other, that's not doing anything. You're perpetuating the issue. And it's not until you actually roll up your sleeves and do this good work, are we not going to see a difference. And those are a lot of the great things that I'm so proud of being a part of the South Bend Empowerment Zone, because never have I seen that in the realm of education until we started doing that here.
And I see you nodding your head, Dr. Larry. Did you want to?
Yeah, I'm loving this conversation. And I'm agreeing with everything everyone's saying. Something I want to add is, in addition to what Savino said about, and Dr. Buggs also said, they identified systems, right? So Dr. Buggs identified the justice system, the penal system. Savino identified the education system. And what that tells me is every system has to come to the table in order for wholeness and in order for wholeness and wellness to be attained. All stakeholders at all levels. And so how do we do that? For example, at my level, I see how I teach, right? I prepare counselors to go into the schools, into school settings or into community agencies. And so it is my responsibility, I take it as my responsibility to change the narrative of how do the counselors in training see people of color. One of the things that I do, some practical things that I do, is make sure that they, at the beginning, the first course, we actually had that last night, the first course that they take, which is Introduction to Counseling, they have to do the implicit association test. They have to come to the place where it is a conscious and intentional part of their training. Because people, as this is a statement that I've coined, behind every behavior is a belief. If you believe something about who I am, you're going to treat me that way. And so we have to start at the root of behavior. And at the root of behavior are beliefs and thoughts. What is it you think about me? Yes, we have all these systems. Systems are made up of people. People have certain beliefs about others, right? And so we have to get all these systems in place. We have to do a major re-education of especially providers, people who are providing service, people who, whether you're a police officer, a teacher, because all of these people, the medical profession, the social service, all of us come with beliefs about what I think about the social other. What I think about the social other is how I'm going to treat the social other. And because we make up systems, it's not somebody else out there. We all do. And so we have to be intentional about the root level. What are we putting into the system? What are we teaching our students? What are we saying when we sit on board in types of meetings like these? what are we doing when you're a part of a community alliance group? What do you believe? What do you believe as a clergy person, right? Do you believe that all mental health issues are spiritual? If that's what you believe, then that's how you are going to teach the people in your congregation. So it's important that we isolate our core beliefs and see how those are all connected to how we behave and how we treat others.
If I may add a comment, would that be possible? I really wanted to add something with what Dr. Larimer just said, and that's about systems, and it's also about providers being present and vocal in those systems. As a physician, I recognize that I'm part of a system, part of a structure that excluded people who looked like me for a very long time and did experiments on people who looked like me for a very long time that were not scientific at all. But the repercussions and outpouring of that still has implications today, such that if people of color weren't at the table, you would still see things like chronic mental illnesses like schizophrenia being overly diagnosed in African American communities and populations, and less instances of depression being recognized. You would think that a lot of the social ills that African Americans experience are just part of them not being able to assimilate or acculturate into American society. I think it's very important that whatever system or structure you happen to be a part of, especially if you're a minority and of the community, that you be vocal about what it means to be part of that system and what it doesn't mean. Because I think only in that we can change the shape of the narrative. That's very important.
Yeah.
And I would like to add too, just like both of them have said recently, changing and getting rid of racism is definitely, it starts with you yourself. What are your personal biases? How do you bring those to the table? How do you share that in your own family? Like if you're in your family and you're complaining, you're saying that this race is labeled a certain way, well, that's what you're teaching your children. And that's where they will know. And in the future, they're gonna keep on repeating the same things they're learning within the family tree itself. So as a healthcare provider too, myself, I have to be conscious of my own personal bias. And I cannot, for example, treat everybody that has high blood pressure the same way. Some people may have the resources to buy the medications that are top of the line. Some people may not. So I have to adjust my care plan to what is my patient needing? What are the resources that they have available? What are some of the barriers that I have to knock down or help them overcome in order for them to be able to concentrate on their disease process? Within mental health, there is a lot of different views. And I think historically, when we think about mental health, a patient with mental health or an individual in mental health disorders, we're thinking kind of extreme. The people that have the mass shooting, oh, well, because they have mental health issues. The mother that kind of killed all her children, well, because she had a mental health crisis. But we kind of fail to recognize like mental health disorders can look like any of us in this room. Perfectly functioning people that can get into crisis issues. So acknowledging that is a big part of the solution.
I'm jumping here because
Yes.
that is so true. And that is part of why it's such a stigma in our communities, because we see the extremes. We see the extreme, oops, hold on. And with those extremes, it becomes a barrier to relationship challenges, conflicts in relationship, feelings of anxiety, feelings of sadness. So when you talk with people in our communities about mental health, they're not thinking about, oh, well, I need some help with solving this problem here with my wife or my husband or my child. Oh, I don't need to see anybody. We can, push through or pray it through. That's also a mental health challenge. But again, the languaging and the word use is so debilitating that I think that's such a great point. Such a great point.
Yeah, so to me, stigma is another one of those social constructs, a design to make people step back, deny themselves access to things. So the color of our skin is stigmatized, and so it's like they say about the preachers, they plate it so full, they can't take nothing else on it. And so you make everything unappealing. So it's just like a lot of things that are designed to help people. Bankruptcy is designed to help people have a fresh start if they get economically challenged. But you have so many people not wanting to do that, thinking that it says something bad about me as a person. I'm a failure. And so it's the same thing, whether it's getting benefits, getting TANF, getting food stamps. It's trying to say, look, we pay our taxes. For a whole lot of our people, we made this country, we are old, that is our money. I would prefer my money going to help my fellow citizen than going to build bombs and things somewhere else. And so you have the stigma that is created for people to deny themselves access to stuff. On the other half, you have a legislative process that makes decisions based on money and power. Right now, our Indiana legislators passed a law that says health officers are not the bottom line when it comes to health issues. It's the county commissioners. Again, one of those things, because money is the driver for most politics. Politics is about who gets what and how much, okay? So they just passed that law. And so I did not hear the Indiana Department of Health, county health officers, nobody pushed back on that. I would have thought that there would have been an uprising saying no. And so you have these politicians making decisions about health issues based on the almighty dollar. And so again, when it comes to criminalization, there is this need to just keep prisons full. You see these privatized prisons, you see these contracts with prisons, you have all of this money invested and obligations. And so once upon a time, the prison industrial complex was designed for us. But after a while, it said, okay, y'all come too. And now all of a sudden, it's like, whoever we can fill those beds with, because the profiteering is so great. Black and brown bodies are traded on Wall Street every day. And so again, until we get the health community making these health decisions, we will continue to have these issues. And so again, stigma is a construct, and people deny themselves based on that stigma. And so a lot of the work that we have to do with people in our community is to help them to understand that this country, this community, these resources belong to them. It is theirs. It is our collective, what we have earned for being human beings on this planet, and so to help people stop denying themselves. And as Dr. was saying, because we have been taught to devalue ourselves a whole lot. And so when it's so timely that we having this in the educational system, because as Savino was saying, starting with the young people, how do we change even that educational system that seeks very early to indoctrinate people, stigmatize people, tell them they have no value? Because if we look at the teachings, it is primarily white males who have been placed on the value system. If we look at providers in the teaching, we're talking about mental health. When you go to school, whose theoretical models are you? You talk about Piaget, Rogers, Freud, all white males, you know, and we have Black and brown people who have theoretical models talking about us. Those are not incorporated. So you have our children being taught from elementary school that they are nobody, they are less than. And then you have providers who are being educated and taught the same things. And so there is a lot of work to be done. You know, a lot of the systemic changes that'll have to happen for us to get to that healthy place that we need to be.
Mm-hmm. Well, one of the things that I've heard kind of come up in different contexts is the need to be connected to the community. So I think what you're saying, Deborah, in part, is if decisions are made on the top from people who have no connection or relationship to people in the community, to those who have the needs. And one of the things I want to encourage everyone who's listening is to send in comments or questions to our panel. And one of the questions that did come up, and something that I was wanting to bring up as well, is the issue of trauma, like how trauma affects people in our community. And I'm talking about the daily trauma of racism. Part of what makes it a healthcare crisis is how we can or cannot cope with the daily microaggressions on one level, but the overt racism and the overt trauma that's produced both in our young people and, you know, it's passed down over generations. So how do we address the issue of trauma in communities of color in a way that can be healing and repairing as opposed to harmful or that ultimately end up being punished and people being blamed for having been harmed?
So it's going through and honestly looking at it and owning it and admit. So there are things, it's like our silence. You know, we talk a lot about our silence. If we think about our silence, the fact that when we were brought to this country, we came with our own native tongues. We had a language. We were denied that. We were told we could not speak to one another in our name. And at times, our actual tongues were cut out of our mouths so that we could not talk. We could not communicate to one another. If you think about the fact that of the things that we had to stand by and watch in silence, our sons, our daughters, our children being raped, brutally raped. Our sons, our brothers, our uncles beat until they were bleeding, beat sometimes until they died. And we had to sit there in silence and not say nothing, or else we would have the same fate. Fast forward to today. And if you think about that scene with George Floyd, that very same message was given to those people standing on that sidewalk. If you come anywhere near this, if you really try to stop, interfere, you will suffer the same fate. And so you saw those folks when they were on the witness stand, how traumatized, they felt guilty, they felt they should have done something. They still live with that to this day. And so that's the historical trauma. And we all go through that. Every time something happens to one of us, we all live that same trauma over and over and over again. And the fact that as a society, they want us to just accept it. And even in the whole thing about religion, looking forward to the by and by, accepting what you have on this earth, the cruelty, the humanity, but look forward to the mansions in the sky. Oh my goodness. So that whole denial is still trying to keep us silent about those things that we have, that we continue to endure. And that's just one aspect of the trauma. There is multiple layers of the trauma that we relive every day. I was talking to somebody Saturday about who is consistently saying things like, I was beat as a child. I beat my children. I've talked to a lot of people from Africa. I've read a lot of what I could get my hands on, African-centered psychology. Nowhere can I find beating of our children as part of our culture, our history, our heritage. And so trying to get those things out of us and us to stop thinking that those kinds of things are okay. You know, so it's a lot of things that we need to talk about honestly and openly amongst ourselves about the trauma, and admit it, own it, and try to work ourselves out of it and heal past it, you know. And it's a lot of hard work, because the pain is going to come every time we talk about it. The pain is going to come. But again, we've endured a lot, you know, so.
And I think so. I think that is, it's a trait that I think that it demonstrates resilience among Black people, but it also something that works to our detriment, and that means sort of enduring it. We are, as a people, have endured so much historically that our everyday existence sometimes can be very traumatic, and we'd be totally almost unaware, because we have to just keep going to do this, to do the other, take care of the kids, take care of the family, take care of the household, take care of the grandchildren, whoever you have to take care of, whoever you're in charge of, it becomes priority. And that makes sense. But that still doesn't mean that trauma doesn't have an impact on you. And trauma, whether it's experienced as a child all the way up through adulthood, or if you happen to be able to escape it and you continue to have stressful life experiences in adulthood, trauma changes your neurochemistry of your brain. It's going to change the way you begin to relate to people, the way you can remember things. It's going to change just your mental processing. It might be the way you even begin to even understand the same types of situation were it to happen before the trauma, the same situation might be interpreted differently after the trauma, so that your limbic system gets activated and you're always on guard. Typically, people respond to trauma, they have to flight or fight, or even maybe a subdued position. They just kind of submit and do nothing. And so you have a people who have historically been traumatized, and some people are going to have that automatic sort of fight. So I'm on guard, I have to defend myself because I need to survive. And then you're going to have some people who just need to escape or run away. And this is not to dismiss substance abuse or addiction or whatever thing that you get into to try to escape, but those are some of the reasons why that can happen. And then some people simply sort of submit and say, this will never change, I can't do anything, and don't try to do anything, and their lives are lived in despair. And so these historical traumas innate in our society as Black people, they exist and they persist, but it is something, yes, we certainly need to talk about, because sometimes we are indeed unaware. And then also talk about in the systems and structures that we're in, so that we as clinicians also can recognize, well, that is a traumatic event. Because if we look at psychiatry, I'm a psychiatrist, and Benjamin Rush, the father of American psychiatry, his claim to fame among many things, and I say that sarcastically, was that he believed that the greatest issue among Black people was that they weren't white. And if they were able to find out and reconcile this deficiency within themselves, they would have better mental health. And so this is the father of American psychiatry. It doesn't mean that psychiatry is invalid or wrong, but it certainly informs me that certain structures, certain ways that I have been instructed might not be, are not necessarily appropriate to treat the kind of people in the kind of way that would be culturally relevant and competent.
Yeah, I think that's what Susanna was speaking to earlier, about being very clear and then working with an individual, not with bias in painting everyone with the same brush.
And I want to add on to what Dr. here is saying as far as the experiential trauma that happens to individuals and the consequences on their health with the flight or fight response. I mean, we have people that are on that high level of stress on a daily living, on a daily basis. And now with social media being part of social justice, for example, with George Floyd, everything was videotaped, the recording was on social media networks. I mean, people could just click a button and kind of technically relive that experience. So I think collectively, not only it affects you as an individual, but as a whole community, because you see the person of color being treated the way he was treated, no respect, and et cetera, and the consequence of that. So I think it affects whole communities too. I mean, how are you gonna feel? You're gonna feel targeted, you're gonna be angry, you're gonna be on an uproar because this is something that is happening on a daily basis.
I'd like to.
No, go ahead.
Sure, sure. You know, Summer, it's hard to keep my composure because I'm over here. I want to jump up. I want to snap my fingers. I want to say amen because you guys are just definitely hitting all the nails on the head. You know, I go to this example and we're sitting here in this auditorium right now and we forget we're not that far off, right? We're looking at some of these words and some of the photos and the dates that are on here. And we're not that far off from what things used to be and kind of continue, you know, we're in that continuation stage right now. You know, that self-hate that's been perpetuated over time, that over so many generations of hearing it, we begin to believe that we are the villain. And it's so interesting. We're in this day and age that we're watching TV and, you know, we see superheroes and Marvel and blah, 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 and everybody's a fan of it now. You know, I say this often, to example, to students that I work with, that no one, if you look at any villain in any type of story, they weren't born the villain. Unfortunately, through circumstances and trauma and things that are out of their control, they ended up that way, right? They fell down that track. And that right there, I compared to forms of mental health, that if anyone's not really reaching out and assisting this individual, they can become what society looks at them as being the villain, that bad person or someone that we don't want to deal with. And we actually believe that ourselves, that we don't belong there, that we actually etch a line in the ground and say, we cannot cross that. And that's the unfortunate part, and that we're seeing so much with racism and mental health right now, that there's just an area that we seclude ourselves to. And that's something that's very unfortunate. But luckily, I mean, we're at this day and age that we're actually beginning to talk more about it. And we're taking those steps towards freeing ourselves from something that's just the biggest scam ever, that we are inferior.
Can I say something?
Yeah, and Dr. Larry, I wanted to ask you, as part of your answer, like, could you also address how is this being taught? Like, how are students in your classes in counseling or in education or in other ways, how is trauma being incorporated as part of the curriculum as well?
Well, we just recently, within the last, maybe 5 years, we have a class now called Crisis and Trauma. Prior to that, it was infused, you know, at varying levels of infusion into different ones of the courses, different courses. But it needs to be, and it's becoming more of a discussion on the topic, because representation matters. Here's what I'm going to say. I am the only person of color in the Counseling and Human Services faculty in the Human Services Department. And if something is not necessarily mandated, but it is a lived experience of people who you counselors would eventually work with, it won't necessarily be something that is at the forefront of your teaching or your syllabus or your discussion with the students. Now, I am, again, the only person of color in my department, and I make it my mission to expose my students to issues of trauma, historical trauma, multiculturalism. Even though we have a class, that's one of the classes I teach, it is critical. You have to be, it is not something that comes naturally to people who are not people of color. You don't naturally gravitate to saying, well, let me talk about historical trauma among people of color or African Americans. It doesn't come naturally. You tend to focus more on the established and the establishments and the establishment of the history of counseling, and like I think as Deborah said, talked about the founding fathers of counseling. Counseling is a completely Eurocentric paradigm that has tried to put, or has successfully somewhat put, people of color in a box, and if they do not fit according to their box, then you are deviant or something is wrong with you. And so one of my missions is to help my students, to help our students understand that many times the box that you're trying to put people of color in, that box is not a good box. The box needs to be changed. The box needs to be broken. The issue is not the person of color. The issue is the box. And what we do and what we have done, which is a disservice to counselors and mental health therapists and educators, and we have a box in this country that was not built for people or considering the considerations of people of color. The box was not built for us. What we tend to do is everything we teach, everything we try to apply is to make people of color fit into these boxes that were not created for us. And then we label them as some type of disorder, some type of deviant behaviors. And so my role, how I talk about this, is shifting, flipping the script. Let's look at the structure. Let's look at the box as being something that needs to be deconstructed and not put the blame on the person, because that has only caused distrust in communities of color, distrust, and also created a lot of disunity within our communities. And so, yeah, that's what I want to say about this part of the conversation.
Okay, and there's another question I want to get to is the issue of obesity in the African American community and communities of color. And the question is, is there a relationship, and if so, what is it? Obesity to mental health, the relationship between the two, or Is there a causal effect, or, I mean, we know that there's many other factors, but.
I think if I might address that, I think there's a couple of things that come to mind immediately. I think you can think about the stress response, increased cortisol levels that happen when stress and trauma is experienced repeatedly. Cortisol is going to change in a very simplistic way your metabolism. It's going to make it harder for you to lose weight. It's going to make probably the weight that you are most likely to gain, that truncal obesity, most prominent. So that's one issue. I think it also brings to mind another issue, the fact that African Americans are diagnosed more often when another diagnosis is actually more appropriate. They're diagnosed more often with more severe illnesses that require stronger medicines or certain antipsychotic medications that have certain metabolic side effects. I'm not saying that they're always inappropriate, but if they're used disproportionately, I think you can also run the risk of having these be the experience of that group of people that falls victim to the misdiagnosis and over-medication. And so those are two things that kind of just stand out to me. Another thing that stands out to me is this. If we look at redlining in communities, we look at where people of color have been pushed or made to live, and they don't have access to healthier foods and other options that they can get to readily, forced to eat perhaps other foods that are not as nutritious, that are high in caloric value, that also feeds into more obesity. So those three things kind of came to mind with that question.
And I would like to add to that on the same page as well, food as a coping mechanism, because there is healthy coping ways to deal with situations, and there is others that are not so healthy. So, I mean, the rates of heart disease in African Americans, minority people, are excruciatingly high, as well as other chronic issues, strokes, heart attacks. I mean, those are pretty common and pretty high numbers. The way of coping in a not healthy way can be related to food. I mean, you can use kind of source to that as a moment of just getting some gratification, feeling good about it in that same moment. And that can lead, of course, to other types of issues with heart disease and et cetera. In the same way, substance abuse disorders can be a coping mechanisms. So when you don't have the ability to cope properly, the resources to cope properly, I mean, what's cheaper, to go to the liquor store or to go find a psychiatrist? Unfortunately, the healthcare cost overall is very expensive and sometimes not available for everybody in the community.
Dr. Heller?
Can I say something?
Yes, please.
So the World Health Organization has made a statement a few years ago. There is no physical health without mental health. And we also know about the social determinants of health, mental health. Part of that is where we live, love, learn, where we're born, our environment, the social determinants have direct impact on our mental health and our physical health. And so if you, as Dr. Bug said, if you are in a community that is under-resourced, marginalized, the infrastructure is, not attended to, or there is none, it's not by chance that people in under-resourced communities struggle with some physical determinants of health, right? So obesity is one. Then we have, there's more asbestos, there's more lead in the water. I mean, this is not happenstance. And this is also not a happenstance that these individuals in these underserved and under-resourced communities struggle with what is called, mental health issues. Because there's a direct connection between your physical health and your mental health. And if there's also that one of the social determinants of mental health is also economics. Economics, access to care, job opportunities. There's also lack of substandard educational opportunities, and the list goes on. And so obesity is just one of the fruits, of underserved and under-resourced societies or communities where people of color who live in these areas suffer with multiple physical health issues.
And Savino, you
Yeah, definitely. So when you zoom into that health disparity of obesity in the African American community, or even the Hispanic community, or even several of the health disparities that you made mention to, Dr. Larry, when you zoom into that, at the core of it is racism. I'm just going to put it flat out there. I know a lot of times we want to diagnose it, we want to put it in this category or the other. Let's call it for what it is, and it's racism. Bam, I said it. So with that said, you know, I have to be careful what I say, or I'm going to be judged as being anti something or anti this or that. But this is coming from Savino Rivera's mouth and not the empowerment zone. But with that said, you know, it just shocked me, you know, in my early years and working with students in education, always in the area of student supports, right? And I would see a lot of our students, and unfortunately, a lot of our students of color who would come in and they would have their honey bun for breakfast, or they would walk around the building with a literal 2-liter of highly sugared type of colored drink, right? And nobody would say anything to them. No one had the time of day to say, why, or asking, why are you putting that in your body? And it was interesting because I remember a student just years ago, I'll give you an example. They actually came up to me and they said, can you help me out with my health class? I have to create a menu of nutritious things, right? For their a nutritious meal throughout the day. And this is a 15-year-old student that was stumped because I said, well, what do you eat every day? Ramen noodles, SpaghettiOs, cereal, milk, pop. Oh, and a honey bun. I may mention that too. So all of these prepackaged, high sodium, high preservatives, things that you made mention to, Dr. Larry, that affect our bodies, eventually gets to the brain. And, you know, we don't have to be a scientist to figure that out, that you're seeing that coming in the physical. And then we wonder why our students crashing in the classroom, why they can't focus, why we're seeing students not being able to put forth the most effort because they have no fuel in their bodies and things that let them regulate as the average person, or someone across town could say, you know, why are you doing that? Because they've been taught different. Food deserts are a real thing. Unfortunately, we just care to drive past them because it's not our issue. As we blink our eyes and we lock our doors, we just hurry up and drive past those communities. And that's something that we got to get way better at.
Yeah, time is winding down, and I think we'd be remiss if we didn't just talk as concretely as we could. I think everyone's brought it up in a different way. What do we do? What's the actions? How do we continue to put pressure on, not only pressure on the board of public health, but how do we address the issues internal to our own communities? How do we do that and not wait for an outside savior, though we need resources? So how do we put pressure on the government, the city, and what do we need to do inside our own community as well to address these issues?
So I'll start again, and I'll just put the government, the city officials, I put them in the category of systems of power, because that's what really we need to change. And we know that race as a social construct is designed to keep, you know, power systems in place. And so if we think of those as those kinds of systems, I think what needs to happen is, as a community of various components, whether that be the faith community, whether that be the higher educational institutions, those communities, whether that be the grassroots community, whether that is the mental health community, We need to really continue to have these kinds of dialogues because our perspectives, we all want the same goal, but our perspectives on approach based on our experiences are not always the same. But I think if we begin to have that dialogue and have some bi-directional or maybe even more directions in that curiosity of how is it you are informed about making these decisions so that we can achieve this goal of decriminalization of mental health. How is it that this group over here does it? And have some difficult conversations, maybe even some disagreements, so we can push that to the wayside to reach the common goal. And I also believe that those people who have the ear of a group of people or can garner a movement just by nature of them saying, hey, let's do this. And some people have that ability. I think it behooves them to bring their group, the community to the table, but also those people who have privilege and access to use their privilege and access to generate change. For me, I know that I have access to other physicians, other educators, easier than other people. So I can use that privilege, that platform to have a discussion and bring those people to the table. And in doing so, I mean, and I know some of you know as well, my husband and I are doing some of the things that we're doing in the community and want to continue to do, and have called out to the mayor's office to do some of those things and partner with us because we want to partner with them. As I work with Oaklawn and other institutions, I think it's just going to take that collective synergy from different groups, different communities to talk and speak our demands to that power, that structure to create change.
I think for me at the university level, what is my next step? What is the next thing to do? I'm going to continue being that voice of let's shift the focus from the person to the box, to the structure or to the system. The person is not the disordered person necessarily. The issue that is disordered is the system. One. The other thing, so at the university level, that's what I'm going to continue doing, having these conversations, ensuring that my students are educated, understanding perspective other than the Eurocentric perspective in counseling. And for my nonprofit platform, I have developed this system that I use, and I'm training individuals to be what I call wellness champions, so that they can help within their communities. You don't have to have a degree, where you can be community members of all stripes and levels can become trained to help each other problem solve. And so that you don't have to wait till something becomes a diagnosis. You are able to help, you're equipped, you're educated and empowered to learn this process and help people within your communities. And those are the things that I am doing. And I think what we have to do is we also, in addition to what Dr. Bogg said, we also have to find ways to disrupt the system. We can't wait for the systems of power to do the disrupting. We have to do that disrupting from the grassroots level, as you said. And so those are the ways that those are my action plans. Those are my action plans.
And if I may add another quick comment, and I don't mean to hog up all the time, but as a mental health professional, clearly one of my passions is mental health and how to best provide that to an underserved, under-resourced community that looks like me. And so what I should clearly say as part of that is establishing a free and shareable clinic of people of color, being the primary clinician, but for the entire community, because I know mental health is a broad issue, but I know because of stigma, because of lack of willingness to have conversations, because there are not a lot of providers that look like us, but there is a community here. And what if we came together to offer this to the community? That's something that I think would be so valuable. And so that's part of my action plan too, part of our action plan, my husband and me.
In my opinion, I think sometimes we feel kind of isolated. What am I going to be doing in this massive problem of systemic racism? I think every person actually has the power to do something about it. Just by simply intervening if there is some racism occurring next to you, just put your foot down and have the courage to speak out, call it out, and keep the conversation going that way. Individually, we have to commit, each of us has to commit to stop racism. So making alliances with other groups, being the voice of underserved communities, I think is going to be very, very important. And then look into your own workplace. What can you do either individually in the workplace or as a whole organization to make sure that we start making some progress against racism? For example, what I'm planning to do and what I try to do and be an advocate for is instead of being what they call in healthcare system RVUs or revenues per patient, in healthcare there is this big push for the more patients you see, the more money you make. I think we need to kind of retrospect a little bit and really put patients at the center. And even though you may be salary, you can still spend more time with your patients and really individualize care plans to help them have better outcomes. So that's my plan right now, and trying to add on services that are needed in my community. So for example, in this, where I serve, there is a high rate of hepatitis C, there is a high rate of substance abuse disorders. So I'm getting the training necessary to be able to add on those services to this clinic. So I think it's important to identify the community you live at and what type of resources are needed. And like the doctor said, be a rebel, start something, make changes.
Indeed, anyone
ahead,
else?
Deb.
So I would like to see more of the community actually claim their power and that power to unite the efforts. We have a lot of organizations out here working to affect some change, but there needs to be a unification of the power, a coming together on a few points, and some of it is the educational system. There needs to be change, a disruption to the indoctrination and more promotion of thought and thinking. And people like Mitch Daniels, who said he would make sure that Howard Zinn's book of the American people never got into the Indiana educational system. To be aware of those kind of folks, we understand what it takes to get accreditation, and accreditation is gotten by maintaining the status quo. And so again, within each of our systems, how are we going to buck those things and affect some change? And so if we all united, most of us united on these efforts, we could do something. And again, if we look historically, real change has always come when we messed with the almighty dollar. And so it's keeping that in mind as well. How can we fool with the dollar to get some change?
Pun intended.
If I may,
Yes.
yeah, if I may, I think it starts with you. We've been doing a lot, folks that are on here on this panel today, but I encourage everybody that's viewing, that's seeing this, get the word out, talk about it, make it the norm. It's not normal to be overly stressed. It's not normal to live in the conditions that you're living right now. Don't accept that anymore. Like they said, stand up, put your feet down, and let's join in this battle. Because until we do, we're going to be continuing having this conversation. I'll see these people next year and the year after that, and we're still going to be talking about the same things until you, the viewer, you, citizens of South Bend, Indiana, says enough is enough, and we start taking on this fight together. This is how it goes, and I'd be a fool not to say this is not what we're doing in the South Bend Empowerment Zone. This is something that we are at the forefront of definitely being anti-racist and having educational equity for all, because everyone in our school matters, our communities matter. And this is something that is being, that I see every day, and that I just feel so blessed to be a part of, because we're starting to see real difference, and that people, and that you know, folks on the West Side, they're not just there, or they're not just gonna, they're just, that we have to take care of them, but they can be a part of that conversation, and they can actually be movers and shakers in this movement. And I encourage you all to join us as well, and just to be a part of this conversation, the dialogue. Do your part, and when you do your part, someone else will do their part, and then that spark will continue, and then we'll see real difference in our community. But until then, this is what you're going to see. If you want to see change, be a part of that. Thank you.
Great, thank you. And I do want to say that many of you know that Faith in Indiana had an event this past Sunday in Potawatomi Park about creating mobile mental health clinics. And that's one response that's being put out there in the community, that we do need to come together. We need to come together as a community and work collectively on this, and relate to our community holistically, not as a fractured grouping of individuals, but that we're all interrelated, and that there's deep interdependency amongst us, that we need each other. So I want to thank this panel for all of your contributions, your wisdom, your suggestions. This is, as I said, this is an ongoing conversation. I want to say that next week, Tuesday, same time, we at the Civil Rights Heritage Center are hosting an event that we're calling Reimagining a Safe Community. And what we think about, when we think about safety, we're not thinking about more surveillance or more policing or more punitive responses to harm, but how do we, again, relate to our community collectively, holistically, and think about safety, what would contribute to a safe community, and having mental health access and addressing the issues of mental illness in our communities is a critical piece of making our community safe. We cannot have safe communities without those kinds of healthcare responses. So join us for that conversation next Tuesday. I want to thank, before we go, on the folks that you don't see. I want to thank George Garner and Brad White, who is our tech folk, who's sitting in the background and making sure that everything runs smoothly. And I want to thank Ashley Kavlar for kind of being the glue that actually organized the panel, kind of kept us all on track as we came together. And I hope to see each and every one of you next week as we continue this conversation and expand it, so that we're ultimately not just talking about it or making proclamations, but we're actually instituting new changes and addressing structures that are keeping us apart. So thank you and have a good evening.